Hello, I am Dr. Sangaswarup. I hail from Khammam district, and in 1997 and December 19th, I had a myocardial infarction in the inferior wall. Then I consulted Dr. Surya Prakasa Rao garu at Hyderabad, who on 5th January 1998 did angioplasty with PTCA with two stents. They were bare metal stents, BOD XT variety, and he advised me my lifestyle change, and as per his guidance I followed them. So in the succession of any disease, either pertaining to heart or any other, there are two parts. The first part is doctor's expertise and his advice and the way he treats the patient. And second one is the patient's part. In this, there are again two parts. The first part is following the doctor's guidelines regarding the medicine, and he has to take them properly at proper time and as long as he advises. The second part is more important than the medicine is the lifestyle management. And regarding lifestyle management, I strictly followed what he told and also what I came to know from others also. So in that, what I did was, as he advised, I started walking, and we slowly, along with my wife, she is Lakshmi Kumari, my wife, and along with her, I used to walk 4 kilometers in 40 minutes to 45 minutes every day. Even on rainy day also, we used to go like that without any hindrance. And regarding the diet, I used to take a low salt, low fat diet, and it contains oil about half liter per month as advised by the dietitian, and that means 15 ml per day per single person. We are 3 in the house, and we used to buy only 1.5 liter oil, and every day we used to cook with that only for 1 month, entire 1 month. And in that also we used to follow the various oils in a mixture, not individually, continuously only one oil, like rice bran oil, groundnut oil, ginger oil, sunflower oil. We used to change them and use them. Like that, we used to follow the diet restrictions. So also salt restriction. We used to use only 3 to 5 grams, maximum 5 grams. Actually, 3 grams only most time. And we used to avoid these pickles. I completely avoided pickles for some years. I have not touched the pickles at all, and I have not stopped walking. And I'm a vegetarian, so I used to take only vegetarian diet, vegetables and green leaf vegetables. And in that also, we never took a fried item. And my wife, she used to prepare the curry just like a fried curry. It is so palatable and looks like fried curry. And my friends or my relatives who visit my house, they used to say, you tell that you don't follow, you follow very restricted diet, you don't take fried items, but it's a fried item, no, they used to say. When she says that I have prepared like this with a little oil and putting some flour on it, it looks like and tastes like a fried curry, she used to tell and show them. So that's how we controlled the oil, and we followed the same procedure till now also. And with that, I have a very good life. I never had any problem in the middle. All these 25 years, I'm okay. And I used to consult Dr. Garu now and then. And we had 2 check angios also in 2004 and in 2009. 2 times they were normal. Both the stents were completely normal. There was no little amount of constriction also or block in that. But recently, I felt a little inconvenience in the chest about 3-4 days back. Then I consulted Dr. Garu. He took ECG and said that why not we go for angio, because it's too long, he said. Then I said okay, and I got admitted. and angio was done, and a new block was found outside the stents, not inside the stent. Both stents are wonderfully clear, wonderfully open, and there was no block at all in the both stents, and there was a no block in the RCA. So then he showed me, and then he cleared it and put another stent in that. So probably that block, I think, I must say that 4 or 5 years back, I had some problems in the house which might have caused a lot of anxiety and tension in my health, and that might be the reason to, I think, for that block to start. Later, because of this corona, as elders, we could not come out of the house. We are remaining in the house only. So there was no walking and there was no exercise at all. So that must be the reason, I think, for this new block. And moreover, I must tell you, all people, that out of the treatment, medicine is one part. But more than that, walking and following the lifestyle management is very, very, very important. Even in the clinic also, after seeing the patient, I don't sit in the chair. I come out and walk in the corridor. I do morning walk. In addition to that, I walk whenever I find time. I walk in the corridors. And also when I go home, I help my missus. So that it's not that I love her so much that I do it, but I do it for my sake. Because if I don't sit in the house, don't sit for continuously for hours together, my life would be good, and I feel it. So in the house also, I am very active. So with this, what I want to tell you is lifestyle management with good diet, with proper diet. That is low salt, less oil diet, with low proteins. When many people think that high protein diet would be good, what is advised in the gyms for gymmers. But even high protein diet is also not proper, I think. I don't know what Dr. Garu says, but very high protein diet is also bad for the health. So follow the low protein diet also, and walking. Walking is a must. Either walking or cycling or swimming. These are three things which I feel are very good for the health, and I followed them, and I advise you also to follow the same thing. Thank you all. Thank you very much.
Hello, I am Dr. Surya Prakasa Rao, Senior Interventional Cardiologist in Care Group. Recently it happened that I checked one of my senior physician, he is very much senior to me. It happened that I have put stents for him in 1998 when he had a heart attack. That time it is only bare metal stents, not much advancement in the stent technology. But what happened is, he is under regular follow-up and doing reasonably good. Only after 25 years, only 1 week back, he had some symptoms. So we have again checked it. To my surprise, both the stents are completely patent, and there is a new block which he attributes that because of the COVID times, he stopped walking and some stress, mental stress. We don't know exact reason, but that new block was cleared immediately. And I am surprised by the patency of the stents, because there is a misconception in the public that why all these procedures and all. With a vast experience and 26 years experience in this interventional cardiology, along with my colleagues, many of them will agree, there is in selective people, all these interventions, whenever it is needed, they are life saving, very important. And also, if somebody has stents before with a good technique and skill, that is also important. Then the follow-up with a vigorous lifestyle modification, they can have the stents patent and can maintain safety and quality of life also. So important thing is that whatever we do, the technology has come. So next generation has come 2002 around this drug-coated stents. Now the third generation drug-coated stents. Sometime observable stents have come. technology is changing, techniques are changing. Now we remove the calcium from the blood vessels without any surgery, and then with called rotablation, then some ultrasonic wave therapy with IVL balloons, and all so many things have come up in the technology, and put long drug-coated stents in young individuals who doesn't want surgery, or in very old people who are not fit for surgery. All of them are doing very well. To my surprise, what we used to see sent for bypass surgeries in 2004-5 is not there nowadays, just because of the not only the skills have improved, the technology improved, and most important thing what I noticed, the awareness. That's why the social education programs to be taken by all the corporate and government sector and the cardiologists and the health education teams. They should take care of these educative programs which contains the diet therapy, like having a low carbohydrate, low fat, high fiber content diet, and also use the right type of oils like rice bran oil and sunflower oil in limited quantities. And more important thing is the exercise program. As per the World Health Organization, 3 sessions in a week is important. More you can do also good with the doctor's advice. And very, very important, we see in young individuals the heart attacks coming. Like today we have 4 heart attacks in young people. All of them got primary PTCA for life-saving procedure. These things happen because the bad type of food they take, the fast foods, a lot of red meat they take, and this type of things are still going on. That's why, and the COVID also added to the clotting high in the body. So I think lifestyle modification with yoga, meditation, and right diet and exercise will keep you healthy, and the stents also will be patent, and the need for bypass surgeries will become less in future. That's my opinion, my cardiologist's opinion also. In selective cases, of course, whenever it is needed, we have to undergo. We can't avoid that in a highly complex cases. Most of the cases we can manage with this type of management. Thank you.